Thank you, everyone, for having me today. My name is Helen Lamont. I work in the Office of the Assistant Secretary for Planning and Evaluation, which is the policy research shop in HHS. You heard from Tisa Marie Sherry yesterday, who is our political appointee, and as she mentioned, ASPE does policy research, and that's hopefully mostly what we're known for, but we also do some coordination work across the department and across the government. And usually when I'm asked to speak, I like to focus on the policy research because we like to be known for that. But today I thought it'd be helpful to talk about some of the coordination work we've done as an example of how we have affected change in the big, slow-to-change federal government. And it's a timely time to talk about this because earlier this month I'm going to go 10 slides ahead. Earlier this month, we hit 10 years of our national plan to address Alzheimer's disease, which we're very excited about. So just by way of background, we have the National Alzheimer's Project Act, or NAPA, which I'm sure hear thrown around all the time. It's a simple 3-page piece of legislation that basically requires two things: a national plan to address Alzheimer's disease and an advisory council to inform the plan. And our plan now has 6 goals, which are laid out here. Everything from accelerating research to treatments to improved health and long-term care, supports for people with dementia and their caregivers, public awareness and tracking progress, and finally our newest goal focused on risk reduction. And I think we've touched on all of these topics over the last 2 days. This week, we're kicking off, our celebration of anniversary events, and I've really taken the opportunity to reflect on and even look through old pictures on where we were 10 years ago. And it's interesting because anyone who's worked in a field or in an organization or especially in the government knows that you're part of lots of different initiatives over the course of your career. They come and go and have varying levels of success. So why are we here 10 years later looking back at NAPA as a success versus some of the other initiatives that we've been part of? Now we have 7 to 8 times more research funding for Alzheimer's disease than we had when we started in 2011. We've expanded programs through HRSA and ACL. We have interest in policymakers from across the globe looking to improve dementia care for this population. And I wonder why NAPA? So one of the things that's been a key part of our success is that we've been extremely collaborative. We work both across the government, within the agencies, and outside of the federal government. Our partnerships extend to our non-governmental partners, like Sarah sitting next to me today, and we are all working together towards these same goals. We talk about this work as win-wins. Everything we do is more successful if everyone can benefit. Early on, in the early 20-teens, the budgets were very, very tight, and there wasn't a lot of extra funds to go around, so we had to get creative. We had to leverage what resources we had and the expertise that we had, and that goes hand in hand with the coordination and the partnerships. And finally, the piece I'd like to focus on has been the commitment and the expertise of our federal staff. So we've had consistent participation by federal staff since the outset of NAPA, and when I say consistent, I mean the same people who were at the original meeting in August of 2011 are still coming to every single one of our quarterly meetings. And these staff care about this issue. They care about improving care for people with dementia. They don't just listen in at the meetings. They go back to their agencies and they push to do more behind the scenes. And if I can add a little bit more to that one, it's not just the commitment of federal staff, it's that they are respected, that they know that they're respected, and that they are appreciated. So we try to recognize them at every opportunity that we have, and I think that further underscores how important they are to the success of this and gives them the energy to go back and to continue to advocate within their agencies. And I think when we see this and focus on this piece of NAPA, it really is emblematic of something we've heard time and again over the last 2 days, which is the importance of the workforce and the importance of the staff in creating organizational change. So real quickly, when we talk about the dementia care workforce, we're talking about everyone from the healthcare providers, the specialists who are diagnosing, all the way down to the community-based organizations and their staff, family caregivers, the direct care workers who are providing that hands-on long-term services and supports. And they do everything from identifying and diagnosing dementia all the way through coordination with family members, care management and transitions, everything we've talked about the last 2 days. And you know, I was listening to Lisa Gweither yesterday talk about her experience, and I wished I could edit my slides and think it needs to be everyone in the system that's interacting with people with dementia, so you don't show up in the emergency room and have to face a gatekeeper who's trying to do their job but just doesn't understand the importance of the specialized care for people with dementia. So what are some of the challenges here? Professionally, we know a little bit more about the long-term care challenges, but these apply to everyone across this continuum. The demand for the workforce is growing as the population ages. Caring for people with dementia is emotionally and physically demanding. They have difficult, complicated chronic conditions and needs. It is time-consuming to coordinate and to work with everyone. The family members have a key role, and they need to be brought into the care team. And the behavioral and psychological symptoms of dementia can be really, really challenging. The wages, particularly for the direct care workers, are not adequate to match these challenges, and the professional physicians will say that the time that they have, which of course is tied to reimbursement, is not adequate to meet these challenges. And then we know that this is a workforce that was really burdened during the COVID-19 pandemic, and that sort of underscored all of the challenges that they were already facing. And as a result, we see high rates of turnover, labor shortages, higher costs to the providers and the health systems, results in poorer quality care. And then if you can't even provide the care that you want to provide at that point, how can you possibly implement a new program or initiative? So as a key takeaway for the committee writing the report, I really encourage you to think about the importance of this workforce. They're extremely valuable. There are literally National Academies workshops and multiple books that focus on this workforce and their special needs, but I just want to make sure that that's incorporated into the work that you're doing, focused on today. The report on nursing home quality that came out a couple of months ago had this as the #2 goal. It came above financing. So I think there's a recognition that this is an important part of the ecosystem and important to having success in this space. It's also important to note that, like all great initiatives, the most effective care is provided by an interprofessional team, and it includes both the long-term care providers and the healthcare providers, and that has implications for financing and how programs and policies are set up. And just like everything else, educating and engaging the workforce has to go hand in hand with the payment and the policy changes. All of that needs to be working together to lead to effective and lasting changes. And like with NAPA, I hope we encourage and support our providers who are doing that frontline work and also recognize their commitment to this work going forward. Thank you.